CBS News medical contributor Dr. David Agus joins us now. Good morning, Dr. Agus. You heard that just now, and you know that President Trump is saying there's a possibility we could have a vaccine before or around November. How likely is that?
First of all, I hate when the vaccines get politicized. The clinical trials are ongoing now, and nobody knows in advance how many cases there will be and how well the vaccine will work. So it really is impossible to say when the vaccine is going to be available. Well, one of the clinical trials, the AstraZeneca-Oxford trial, was started a while ago in South Africa, Brazil, and the United Kingdom, and has accrued a significant number of cases. So my gut is that will be the first one to yield a result, and we'll see what the data show.
Any ideas as to when that would be the first to go?
I think it's possible that we could see this vaccine data in September or October, which means that we would have a vaccine sooner. Remember, every day sooner we have a vaccine, that's 1,000 or more lives saved in the United States.
For people who are still trying to sort of make sense of this, I mean, you say it could save more lives, but in terms of how this vaccine would work, and how effective this vaccine is. We've heard that Dr. Anthony Fauci said that the efficacy rate could be about 60%. Explain that and how effective that these new vaccines could be, these early ones.
So these vaccines take a piece of the virus and they inject it into you, and then you make an immune response, which protects you from the whole virus, the active virus. What the FDA has publicly said is you have to reduce symptoms of COVID-19 by 50% or more to be approved. That's the metric. Fauci had said we hope it's 60%. So it's not going to eliminate the virus, but it will, in many cases, make it so you're not symptomatic. In other cases where you would have been hospitalized, you'll just have a bad cold. And I'll take that any day of the week over what we're seeing now, the pain and the suffering with this virus.
And this isn't just you take a shot and you're done, correct? This would be 2 shots?
Right now, the vaccine candidates are a day 1 shot and either 3 or 4 weeks later, what we call a booster shot. When you do that booster, the immune system makes a much more powerful response, both antibodies and T cells, to fight the virus.
And we know that Moderna and Pfizer started their phase 3 trials last week, and this is the last phase. What happens in that final phase of vaccine testing?
So the final phase, so 3 are in that we're considering the United States, the AstraZeneca, the Moderna, and the Pfizer. And half the people get basically a water shot, a salt water shot, and half the people get the vaccine. And then they look at symptoms associated with COVID-19 in both groups. When it hits statistical significance, bang, the FDA will review the data and we'll get it out. In the first week, for example, in the Moderna study, about 1,200 people signed up. 30,000 people are needed for the study. So at this rate, accrual is slow. We need quicker accrual in the trial. People have to step up and be heroes and be a part of the solution here in the United States.
You just heard earlier, too, that Ohio Governor Mike DeWine tested positive, then he tested negative. He had the antigen and then the PCR test. Can you explain the difference, and what does that say about where we are with testing? This is a, high official who got tested, and one thing showed something, and then a totally different test within 24 hours.
I'm with you, Jerika. This is an issue. The antigen test is a quicker, less expensive test that is slightly lower on what we call sensitivity. It can miss some positive cases. In this case, it was the opposite. It called a test positive. The PCR test, more specific, classically takes hours or days to get the result back, but it was negative. So why was there a false positive with an antigen test? I don't know. Was it a problem with how it was run or something of the kind? The samples were mixed up? I really don't know, and it's an issue. And if this is happening to the head of a state, can you imagine what's happening in testing to everybody in the country? So we certainly need to continue to improve on testing in this country.
Do you think PCR is better because you're looking at what's in the nose and the throat and the respiratory area?
Well, for the antigen test and the PCR, they both take a swab from the nose. The antigen test looks for a protein on the virus, whereas the PCR test amplifies the genetic material. So that amplification test makes it more sensitive. If you're looking if you're infectious, they're both good. If you're looking if you have the virus at all, PCR is a better test.
Okay. Dr. David Agus, thank you so much.